So let's talk about sutures. So I'm just going to talk about a couple of the most commonly used types of sutures, because there are literally dozens and dozens of different materials that are used for suturing. The most common type of suture we use in our office is chromic gut. So chromic gut suture is basically a resorbable type of suture, meaning it'll dissolve on its own. There's no need to go back and cut it out, which is great for patients. That's what they like to hear. And I use it for dental extractions, when I do a socket graft, for most type of surgeries, biopsies, anytime we're doing crown lengthenings or anything like that, where I need the tissue to be held in place for about 3 to 5 days, and after that the tissue will kind of heal on its own and the suture will fall out on its own. So chromic gut is the most common type. Again, it'll stay in the mouth anywhere from, what I say is anywhere from about 3 to 7 days. After that, the person's own saliva will actually degrade the suture and it'll either fall out, they can spit it out, or they'll swallow it. It's not going to harm them at all, and then it's gone out of their mouth. The second type of suture that we use is called Vicryl, or polyglycolic acid, or PGA. And Vicryl suture is different than chromic gut in that it'll actually stay in the mouth for a much longer period of time. It's kind of a dissolvable, non-dissolvable type of suture. So it'll actually stay in for weeks. And usually we don't want a suture staying in for weeks. So usually we'll go and cut it out after about 2 weeks or so, depending on the surgery. So I'll use Vicryl suture in cases when I'm doing a slightly bigger bone graft and I need the tissue to be held in place for a longer period of time. Or in certain extraction cases where the patient's a very heavy bleeder and I really want a little tighter knot and the suture to stick around for a little bit longer. So again, Vicryl is what I would classify as a non-dissolvable suture, because it may stick around for 6, 8, 10 weeks, and we actually have to go back and usually cut it out at about the 10-day, 2-week mark. The other suture we use is silk suture. So silk suture is a non-dissolvable suture. And we'll use this in certain cases as well, but not so much anymore. But again, if a patient has silk sutures placed in their mouth, you can let them know that we are going to have to cut the suture out at some point. So the next type of suture that we use is called PTFE, or cytoplast. And this is a non-dissolvable type of suture. And I use this for my bigger bone grafting procedures. And so this is usually a white suture, which handles very, very well. And I like it because of the knots that I can get with it. But it is non-dissolving. So for these bigger bone grafting procedures, if you see that I've placed a PTFE, or a cytoplast is a brand name, a cytoplast suture, you can let the patient know that we're going to be taking these sutures out down the road. The last type of suture that we use in this office is plain gut. So plain gut is similar to chromic gut in that it is dissolvable, so it'll just dissolve right out of their mouths. Plain gut lasts even shorter than chromic gut. So it may last 1 to 3 days and then kind of start dissolving out. I use these when I'm doing an all-on-4 procedure and we're putting on a fixed prosthesis on top of their healing gums. I don't want the suture to stick around for 7 days, attracting food particles and trapping things under there. I want them to dissolve as quickly as possible. So in those cases, I'll use plain gut sutures.